This video is not intended as medical advice. If you'd like more information on topical steroid addiction, please visit redSkinSyndrome.com. Hello, I'm Douglas Maddy, and today I'm going to be talking about the pathology of topical steroid addiction. So let's say that you start off with normal skin, quote unquote, whatever normal may be to you. At some point, what will happen is a rash will occur, and this rash could be a result of atopic dermatitis, contact dermatitis, some other form of eczema, or it may even be something like winter itch, or some people may have a rash after they've had surgery, or redness. So what happens is you get prescribed steroid creams, and this helps with the redness and calms down the inflammation. And what steroids do is they constrict blood vessels and the rash clears up. Now at some point you stop using the steroids because it comes to the end of the time that you're meant to take them. So what sometimes happens after a course of steroid creams is that the rash will come back, and it will come back a bit more ferocious, and the dermatologist will look at it and say, oh, that looks like the original skin rash. Let's say it's atopic dermatitis. Okay, so that's a bit of bad eczema. You need a bit of a stronger steroid on that. So in most patients, after a course of steroid creams, it will clear up the rash nicely, and it won't be an issue. But let's say that for whatever reason, whether the wrong strength of steroid cream was prescribed, or whether it was taken for too long, or whether it was applied too much, whatever the reason may be, some people may run into trouble. So when they stop the course of steroid creams, instead of it getting better and it maintaining that, sometimes the rash gets worse. And when the dermatologist looks at this worsening rash, they believe it to be the underlying skin rash. So they diagnose it as a bit of bad eczema, and then they prescribe more steroid cream. So let's, for this example, just assume that the rash is eczema, because eczema is the most common skin rash. So because the dermatologist has given a misdiagnosis of bad eczema, and that they don't realise that it's a delayed reaction to the steroid creams, in this phase people are having the steroid creams, then they're stopping, then they're starting again, then they're stopping, and they're starting again. And this phase can go on for quite a while. This can be months to years. And what's happening is it's fostering the skin into an addictive pattern because of the steroid creams. And people keep applying the steroid creams. It could be for a few weeks or months, even years and decades at a time. People are applying steroid creams because they believe that they have bad eczema and they need the steroid cream to maintain it. When really a medium strength steroid cream applied for a few weeks is a kind of average guideline depending on the condition and such. I mean, it all depends on the individual patient and what the condition is and all that kind of stuff, but generally speaking, steroid creams aren't meant to be used for a prolonged period of time because of the side effects that they're known to have. So two things can happen at this point. One is that the eczema is cleared up and people just keep applying the steroid creams and they get on with their life believing that they have normal healthy skin. Or the other thing that can happen is that the potency of the steroid cream wears off. This is known as tachyphylaxis, and so you could have plenty of steroid cream on, but because the skin has gotten used to it, it no longer works. So what happens is you'll be putting the steroid creams on, but people will still be itchy, there will still be patches of what seems to be eczema. So what's basically happening here is that the steroids are constricting the blood vessels, and then when they're either being stopped applied or the potency of the steroid wears off through tachyphylaxis, the blood vessels then vasodilate in reaction to the vasoconstriction of the steroid creams. So this phase of applying steroids because you believe that you're suppressing an underlying skin rash can go on for months to years because of misdiagnosis. So then what happens is people either find out about topical steroid addiction, or more often than not, they don't find out about it, but they realise that the steroid creams aren't really doing anything anyway. But either way, they stop taking the steroid creams. And when this happens, because this is a drug addiction, the body goes into a withdrawal phase. Because this is an iatrogenic condition, the only way to stop this addiction to steroid creams is to go through withdrawal, which is to completely stop the steroids altogether. Now the trouble is, withdrawal lasts between 1 to 4 years for the average patient. Now this is what makes it a very peculiar healing pattern. So once people stop the steroid creams, within a short space of time, it may be a couple of weeks or a month or two, the skin will erupt. The skin will get really red, hot, burning. I'm saying some of the most common symptoms. It varies depending on the patient. But there will be intense itching, pain, edema, flaking, oozing. The withdrawal goes in cycles, so the skin will seem completely inflamed, and then it will dry up, it will flake off, and then it will go inflamed again. There will be oozing from the blood vessels because it's also red and itchy and hot. This may look as though that the skin's infected when it may not be. This is when people are put on antibiotics and various other drugs and advised to use steroid creams again. So the skin will be really bad for a long time because what it's doing is it's replenishing itself. During the first year of withdrawal, there may be a bit of light at the end of the tunnel. Things may calm down a little bit, but what happens is the redness then comes back again. This can sometimes happen around 1 year into the withdrawal from steroid creams, as it did with Charlie. This is known as an anniversary flare. This is when it's the most difficult time because you've stopped the steroid creams, things have gotten much worse over the year, you've had a variety of symptoms, very peculiar things are happening to the skin, all sorts of random things are happening, and then 1 year in, the skin's never looked so bad, and everyone's telling you to, by everyone I mean maybe family and friends, but particularly the dermatologists, are telling you to do as the doctors say, and the doctors are saying do as we say, and take the steroid creams. And this is the first year, at the end of the first year is very difficult for most people, because it's one of the lowest points that people have, and they've had enough of it, and they just want to end it one way or the other. But if you can get past that phase, I say a year in, it's roughly a year in, then again the skin starts to exfoliate and replenish, and there's a bit more light at the end of the tunnel, people start sleeping a bit better. You enter the second year, and it just keeps going on like this, and as you can see, the green is where the skin shows it getting better, and the redness is where the flaring occurs, because as I say, it happens in a cycle, but the cycle decreases and decreases and decreases. It will still flare, but it will be nowhere near as bad as the first year of stopping the steroid creams. And then eventually what happens is you stop flaring. Now you may have the original underlying skin rash, depending on what you were originally taking the steroid creams for. Basically what's happened is you are now cured of the topical steroid addiction. At some point into the withdrawal, a lot of people believe that they just now have the underlying skin rash, but really it's incomprehensible to people that this does really last years. So although it may appear that they've got the trivial rash that they may have had before, it may just still be the withdrawal from the creams. An important thing that I would say is if you're going to stop steroid creams, is to seek medical advice, because you're going to need medications and you need an understanding dermatologist and to go through this, because to go through it alone is not only dangerous, but it's just horrific. You need somebody there to be able to prescribe you itch medication, pain medication, anxiety medication, sleep medication. You really need to have help through this. The trouble is, at the moment, because of the misdiagnosis, because it is an iatrogenic condition, the dermatologists are still saying that either A, topical steroid addiction isn't a real thing, even though it is, and or that B, it does exist, but it's so rare that, you know, steroid creams could affect people badly. I've tried in this video to give a very simplistic explanation just to differentiate between a rash of eczema, for example, and an addiction to steroid creams, because the lines are very confusing and it can be quite blurry. And when some people say, well, how is the steroid cream causing these problems? Well, this is how it's doing it. And this really takes up a lot of your life. Let's say, for example, you're on steroids creams for a year, which people are on and off, as it continues to make the worsening rash. Well, say that's a year, say the withdrawal from that is 4 years. Well, that's 5 years of your life. I mean, these are averages, it all depends on the person, but people can lose like half a decade of their life just because they've been overprescribed steroid creams. The administration of steroid creams isn't correctly monitored. I hope this very basic explanation has been helpful in understanding the difference between having a rash of eczema, for example, and having addiction to topical steroid creams. This video is my personal understanding of this condition based on the papers that I've read. But please bear in mind this is my interpretation. If you would like more information, or you would like particular information about how this disease manifests and would like help from a doctor to explain and to help you through topical steroid addiction and its withdrawal, I recommend redSkinSyndrome.com. If you'd like to see more of these videos, subscribe now. Also, if you're watching this on Facebook, please like and share the information.